Hello and welcome to On TB, a public health advocacy show that is focused on the dreaded disease that is called tuberculosis. Hi guys, my name is Mella MD and I am a rural health physician here in Olongapo City. I have attended 3 of the prerequisite training for the National Tuberculosis Control Program so that I can be able to manage adequately tuberculosis patients here in the country. One of these prerequisite training is integrated management of tuberculosis in children. 2 is the recently concluded seminar on the manual of procedures of the National Tuberculosis Program. And 3 is the programmatic management of drug-resistant tuberculosis. As for experience in patients, I have been able to graduate about hundreds of patients already in the Philippine government's Directly Observed Therapy Short Course or the DOTS strategy, and also under the PMDT I have graduated at least 2 patients under the Category 4 regimen or the previous Category 4 regimen for drug-resistant tuberculosis. Now, this show is going to be focused on what is tuberculosis, on how we manage tuberculosis, on why we manage tuberculosis, and what you can do to help. This show on TB will be featured on my channel, the Zero MD channel, every 8 o'clock p.m. every Tuesday on YouTube. So if you want to stay tuned for more on tuberculosis and tuberculosis management, I suggest you subscribe to my channel. Today, we are going to discuss what is tuberculosis. Tuberculosis is the name of the disease that is caused by this bacteria called Mycobacterium tuberculosis. The picture on the right is the actual scanning electron micrograph of the offending agent. Once a patient is infected, it can affect any organ in the human body. Of course, tuberculosis is transferred via air droplets, so the most common organ affected is the lungs. Although the presentation may vary according to what organ can be infected, the most common, since this is a chronic disease, are weight loss and loss of appetite. According to the World Health Organization, tuberculosis is the second most common cause of death due to an infectious agent, the top being HIV/AIDS. This is the 2009 World Health Organization prevalence map for the disease tuberculosis. The yellow areas show a very high prevalence rate wherein it reaches up to 1,000 patients per 100,000 population. The blue areas show areas or countries wherein there are 0 or a very low number of patients per 100,000 population. The countries who have first-class access to healthcare have very low prevalence, as evidenced by this map. In Africa, where this disease originated, the prevalence is still very high. Also, as noted in the 2009 world map, the Philippine Islands also maintains a very high prevalence rate. Despite the fact that anti-tuberculosis medications that is adequate enough to provide cure existed 30 years ago, eradication or total annihilation of this disease has had only a very slow progress. Historically, tuberculosis is known by many names. Since its discovery by Robert Koch, it's been known as the Koch's infection. In the Bible and very old texts, disease like tuberculosis present as a disease that eats away human flesh. So one of the names given to it is consumption or phthisis, or in other texts, phthisis pulmonalis. Based on the observations of other scientists and physicians, the radiologic examinations began to have names attached to them, such as the Gons focus and the Ranke complex. Presentations of tuberculosis outside of the lungs also have different names, such as the scrofula or scrofuloderma, which is tuberculosis in the lymph nodes, and Pott's disease, which is tuberculosis in the vertebrae. Rasmussen's aneurysm is the presentation of tuberculosis when there is blood in the sputum. If you're going to be involved in tuberculosis management or in health advocacy programs pertaining to it, you will hear the letters TB a lot. TB is actually an acronym for tubercle bacilli. If you encounter MTB, it's actually the same as TB, only used in old text, which means Mycobacterium tubercle bacilli. Today, TB is synonymous with tuberculosis. To make matters worse, drug-resistant types have additional letters attached to them like MDR-TB, XDR-TB, TDR-TB, and RR-TB, all of them to be discussed on a future podcast or episode. You will also encounter acronyms pertaining to the location of the TB. PTB is the most commonly used acronym, which means pulmonary tuberculosis. You may find EPTB or extrapulmonary tuberculosis in old forms, and GITB, which also pertains to TB in the gastrointestinal tract. TB is mainly transmitted through transfer of droplets from an infected person. TB is therefore transferred through speaking, coughing, and spitting. The bacteria has developed mechanisms to survive the outside environment. It can go against weak disinfectants and even in dry conditions. Therefore, it is very important in public health to promote cough etiquette to prevent the transmission of this disease. You can watch an example of a public health message promoting cough etiquette by clicking the link below. The initial symptoms of tuberculosis are the same as with other chronic diseases, such as loss of appetite, weight loss, fatigue, and night sweats. Since the lungs is the most frequently involved organ, coughing out of blood or hemoptysis, and pleuritic chest pain are frequently seen in most patients. For other sites or extrapulmonary sites, tuberculosis presents as a mass lesion. Although it can affect any organ, it is rarely found in the heart, in the skeletal muscles, in the pancreas, and in the thyroid. For the treatment of tuberculosis, I will be discussing them in a new video or a future podcast. Just to give you an overview of the drugs used for tuberculosis treatment, there are two types. The first one are the first line drugs. These drugs are the most effective of them all. They also have few side effects. The drugs are rifampicin and its derivatives, isoniazid, pyrazinamide, ethambutol, and streptomycin. All of the other anti-TB drugs are considered second line, and they have limited efficacy and hence a longer duration of treatment. Using these second line drugs require special treatment and familiarity. Even though we have effective drugs against tuberculosis, it is very hard to treat. Now, these are just an overview of what we will be discussing in future podcasts or videos. The most important of the factors is the bacteria itself. The bacteria, Mycobacterium tuberculosis, has evolved mechanisms to defeat the cells of the immune system. As mentioned before, the bacteria is resistant to weak disinfectants and dry environments. Also, the bacteria has evolved to develop resistance to most of the first-line drugs. The second factor is the host itself. The host may have prevailing myths, stigma, or is suffering from discrimination from the community. The host may also have comorbid conditions that can cause immunocompromise and increased severity of tuberculosis. In third world countries where tuberculosis thrives, the nation usually has poor access to healthcare. Most of the patients live in rural areas, especially wherein there are limited access to roads. Although the poor patients are the targets of the health information drive against tuberculosis, they may have very poor understanding of the disease even if it is explained to them. In my practice, tuberculosis patients stop the treatment due mainly to the side effects. Another factor are the drugs itself. There are no adequate drug regimen whose duration is less than 6 months. Current drug studies show that there are more effective drugs available in the market, but third world countries cannot get hold of them because of the cost. Some of the drugs that are currently being given free may not reach their targets because they have no sustained political commitment. Due to other factors like distance from the health center to the home, some of the health workers do not follow strict directly observed therapy. Some physicians even market ethambutol here in the Philippines as vitamins for the lungs. The following are the factors that involve the physician or the health worker. Some of them do not actually support the DOTS strategy being implemented by the government. Some of the doctors implicated are even specialists. There has been reports of physicians using experimental drug regimens which last less than 6 months, and also the use of monotherapy. Now, both of these invite drug-resistant tuberculosis to form. Since tuberculosis can mimic any pulmonary infection, especially pneumonia, also it can mimic mass lesions elsewhere in the body, there are a number of cases that are misdiagnosed and treated poorly for tuberculosis. There are also health workers that, due to time constraints, provide inadequate explanation to the patients regarding the side effects and the duration of the treatment. Lastly, the following factors involve sustained political commitment. Some areas in the world are torn by war or political uprising that political commitment is nearly impossible. Also, one of the reasons cited by most government officials on why their tuberculosis is very high is always the lack of funds and capacity to transport the drugs and the health workers to patients. In third world countries, there is a significant lack of health workers to continue the drive against tuberculosis in most areas. Due to the promotion of passive case finding, tuberculosis, especially in far-flung areas, have not been adequately treated by the government. The push, therefore, of TB eradication for the 21st century are the following: health advocacy, health education, screening of tuberculosis, getting adequate treatment for the cases, creation of policies, and enforcing those policies, guidelines, and laws. And lastly, active case finding or going house to house to search for TB cases. And that's all the time we have for today. Thank you very much for watching, and stay tuned for more details on the topic of tuberculosis every week, every Tuesday here on youtube.com/0melia. Again, this is Doc Zero saying bye bye, and I hope to see you soon on TB. The Zero MD channel is a public service program that focuses on health advocacy. If you have ideas on future shows or if you would want to collaborate, you can express your wishes on our comment section below or follow us on Twitter at ZeroMD or on Facebook at facebook.com/ZeroMelia. Feel free to share the info you have learned with others so that we can get our health messages across. Thank you very much for watching.